So here we are. We're at the Ben and Gary Show. We know dentistry, and we've got a very, very special guest for us, for you actually, today. And this is Dr. Armando Retana. Dr. Retana, welcome to the show.
Thank you for the invite.
You're welcome. You're welcome.
I feel very honored.
We're really, really glad to have you. And why is it so special to have Dr. Retana on? Dr. Retana is an oral surgeon. And not only is he an oral surgeon who deals with teeth and the jaw structures, but he's also a plastic surgeon, boarded in both. And so he's here to kind of shed some light on a few topics that we've had kind of come up on the show. And one of them was, how can plastic surgery and help you with maybe perhaps looking a little younger? How can dentistry, actually I should say, make you look a little younger here? A lot of times there's a connection, and we're here because you are connected to both. And so maybe you can shed a little light on the ways in which you talk to patients about how they can look a little younger.
Sure. I mean, it goes hand in hand. When I have a facial rejuvenation consultation in my office, and we talk about like the comprehensive approach of things, and I tell them that as we age, three major things really happen. One of them is loss of volume in your cheeks, in your face, from losing fat, losing your muscles getting smaller, atrophying, and also your bones also getting a little smaller. And another thing that happens is that we may start losing some teeth and some of that bone support that our teeth sort of keep in place over time. And as we age, we're also more prone to the effect of gravity, right? How things just start to move down further and further.
I was going to mention that'd be the fourth thing that you. Matter of fact, actually, maybe first. Gravity just seems to affect us all.
You cannot escape from gravity. It just keeps happening, right?
I'm in denial.
Yeah. It's not just a river, denial.
Yeah.
Yes, and so as we age, we also lose a lot of support in the face, like collagen formation, elastin, or the elastic fibers get a little loose. So all those things happen, and to restore someone's facial appearance, we can approach it from soft tissue, or we can approach it from hard tissues like teeth, bone, and that kind of thing. So that's where dentistry really comes into play, restoring the support structures of the face. And you guys are all about that, starting with prosthesis and moving on to fixed stuff.
The first thing that comes to mind is even like a denture or any kind of anterior teeth. When you are placing the teeth there, the older person, like you said, they're typically going to show less teeth. So like you mentioned before, like you have to position the teeth in the right place so that you can show more. So for the appearance of being younger.
That's right. Yeah, one of the things that I think about is when we're young, we smile, we show, or when we talk, you see our upper teeth a lot, and then when you age, you start showing a lot of your lower teeth. So it's like a telltale sign of someone sort of aging, and you guys get to play with, planes of occlusion, vertical dimension of occlusion, and sort of like get to set those teeth where you want them to be to make someone look more beautiful and younger.
Right. Yeah. Exactly.
Yeah, that's the first thing I think about is when somebody takes if they've come in with a denture and they take it out, and it's like how different. Right, that really gives you the full understanding of like what not only your teeth, but the bone that's supporting your teeth help to support your facial structures from basically from your chin to your nose. And it's shocking like how much change that can have. And it's really awesome that we can have the ability to create change and maybe turn the clocks back a little bit just by doing sort of a dental sort of facelift, which might be simply redoing their dentures or redoing them in such a way that gives them much more facial support.
Right. It fills out their mouth.
Fills out their mouth. And so I'm always curious to know. Here's something that kind of comes up in my mind is that dentistry can take it but so far. But then there's a lot of individuals who say they want a little bit more. It's like for instance the area right up under their nose in this philtrum area. But the prosthesis can only support but so much. That's where I always feel like I want to hand that individual off to and a person with your expertise. What would you tell that individual as they come into for a consultation?
Sure, you just have to see what the true problem is. Is it bony support? Is it can we mask the problem with derma fillers, like with a little filler injection, very minimally invasive, quick kind of thing? or do we need to go and do surgery? Do we need to reposition that maxillary bone? Do we need to advance it, or do we need to do any other soft tissue work in that area? So it's always a spectrum of like minimally invasive, soft tissue surgery, hard tissue surgery. So, I really get to play with all of them because I'm a maxillofacial surgeon, and then with all the hard tissue work that I've learned, and then also the soft tissue work from the cosmetic surgery and things. You know that what you just said about the dentures, like, what do you think is someone comes in with their dentures in place, and then so picture like grandpa, picture like picture what 70, 75, 80-year-old men with dentures, and then you ask them to please take off those dentures.
Yeah.
So, how much do they age when they take off those dentures? How many years? 5 years, 10 years, 15, 20 years? Like,
I think it's like instantaneous. It's like a decade,
right?
I mean,
At
easily,
least.
at least that.
Yeah.
It's amazing how much the change.
So patients ask me all the time, how many years can you take off my face by doing a facelift? And it's about 10 years, about a decade.
Yeah.
But with dentures, I think you can restore someone's facial support and give them back at least 10 to 15, maybe 20 years of rejuvenation.
And not just dentures, fixed teeth.
Exactly.
Which is even better. The next step up.
Yeah, that was referred to that, and I have, I had relatives who had prostheses like that here, and it's almost commonly known as the plate. You get a plate, and that just sounds so archaic, right? It just doesn't even sound pleasant at all. So that's a denture. So for those out there, that's kind of like synonymous with that. But that's still something that you have to take in and out.
Right.
The next step up, of course, is if they have a denture. What are some of the common things that you find that patients are coming in for? Let's put your oral maxillofacial surgeon hat on. I want to go from denture. I need facial support. How does that consultation go with them for you?
In terms of oral surgery.
Oral surgery stuff.
Yes.
Yeah.
So I tell them, there are options. We can convert that denture that just is being held in place by their gums and their bones, and we can actually put a couple of implants on the bottom and maybe a couple of implants on the top, and get those dentures to be supported by dental implants, which are titanium screws in their bones.
Right.
And also we can move on a step further where they can have something fixed, right? Something that has less of that pink acrylic and more of just the teeth and a little bit of pink. And that would be a hybrid prosthesis, known as a hybrid prosthesis, with placing a few more dental implants on the bottom and a few more dental implants on the top. And then going a step further, which is crown and bridge work, placing more implants, and then having the prosthodontists really work with their expertise in terms of trying to recreate that bony, the facial support with crowns and bridges.
Right. And I always find that when we are doing those kinds of things, that not only does it restore confidence, but it just makes people just feel better about themselves. There's definitely a huge psychological component. Do you guys find that to be the case?
That's very true. Yeah.
Especially when they don't have to take it out. I think there's a psychological component to taking your teeth out.
Correct.
It changes them completely. As far as they're much more outgoing, they're smiling more, and all that. So it's a total change in personality.
I've always wanted to be in those appointments when you guys deliver those
Come on over.
and they look in the mirror and they just start getting emotional about having something to function with better than what they have, but also their aesthetics, their appearance just changes.
Yeah, no, it is amazing. It's a great treatment that we can deliver for them.
Definitely the best appointment, right?
Yeah, it's also an appointment, but also I look at I'm switching back between your oral maxillofacial surgeon and to your plastic surgeon and hat that you need to put on here. And when I think about what you do on the front end to be able to help someone visualize, like what they might look like if they came for a consultation to help them feel more confident. To me, I feel like that's the place where it might be the equal part of where we deliver on the end, and they're very emotional about that here. But do you find that to be the case when it motivates people to be able to move forward with something?
Yeah, I mean, I feel like patients go through an emotional roller coaster through, where they may start here in the office and you give them the idea of like, you could have something fixed, you could have something better than what you have, and then they come to my office and then we go about all the options that they can have. I actually have before and after photos of previous cases, of you know what patients started with and what they're where we could take you, and also, again, like they just go through an emotional roller coaster. Like they get excited about that kind of thing. They're like, you mean I can have that? You know, that kind of stuff.
Yeah.
And then to be able to close the loop, you know, and have that last appointment here at the prosthodontist is kind of like, you know, wow.
It is wild. Yeah, it is wild. It's a whole team effort, you know, between our technicians, our assistants, it's a whole team effort. But, in addition to what we do as the clinicians.
Right.
Well, I really enjoy that you were able to join us this afternoon, and we look forward to having you on the show another time here, but I just felt like we wanted to be able to interject a little bit about what the connection between, I guess, medicine and dentistry, oral maxillofacial surgery, prosthetics, as well as also plastic surgery, that would allow individuals to have a much more youthful look and have a much better feeling about themselves. So I really appreciate you joining us.
Yeah, thanks, Armando.
I appreciate you guys having me.
All right,
Yeah,
happy
really
Friday,
good.
everybody.
Happy Friday.
All right, it's the Ben and Gary Show. We know dentistry. We'll see you next time. Thanks a lot.
Bye.